Welcome to the Pod of Inquiry, pushing the envelope for human understanding and optimization, the podcast for podiatrists. The Pod of Inquiry is designed to empower you with knowledge. What happens from there is up to you. Your host, Dr. Stephen Barrett, has designed this show to take you down some very deep rabbit holes, hopefully bringing you back out again, relatively unscathed, but cerebrally whipped, enabling a better understanding of all things worthy of inquiry. If you have more questions after the show, then that is good. The new discovery today many times was the new discovery 50 years ago, only to be suppressed or plainly ignored. Medicine and surgery can sometimes take a long while to get their paradigm shifted. We hope to have a lot of fun on this show and maybe destroy some ridiculous dogma along the journey. Thanks for joining the show today. Let's start spelunking.
I'm really excited about our guests today. Well, hell, I'm excited about every guest that I have on this show, so let's be honest. But today is really a great episode, and I think everyone will find it a wonderful conversation. I've got Dr. Stephen Sideroff, who is a distinguished clinical psychologist, author, and expert in the field of peak performance and resilience. Dr. Sideroff brings over 4 decades of experience in brain research, clinical psychology, and innovative biofeedback techniques. He is the author of a groundbreaking book that has just come out called The 9 Pillars of Resilience, The Proven Path to Master Stress, Slow Aging, and Increase Vitality. I think we all want that, don't we? This text offers a comprehensive approach to building mental and emotional strength. His work combines cutting-edge neuroscience with practical strategies for enhancing our ability to thrive in the face of life's challenges. Today, we'll explore his new book, The 9 Pillars of Resilience, and discuss the impact of stress on our brains, bodies, and longevity, and learn some practical techniques for building a more resilient mindset to help you handle stress more optimally. Please enjoy this wonderful conversation I have with Dr. Stephen Sideroff.
All right. Well, I guess it's morning out there, Dr. Sideroff. Thank you for agreeing to come on to the Pod of Inquiry, and we're going to talk about your book, The 9 Pillars of Resilience, which I actually finished reading for the second time. And I want to thank you for coming on, as well as providing me a preview of the book so that I could kind of prepare for this. It actually helped me quite a lot.
Great. Well, it's my pleasure, and I appreciate that you've read it twice.
Well, truthfully, I think we need to read this one more than twice because I think the first time I read it, I was just looking at more from an overview, and then you have so many exercises and techniques in it, then I tried to focus on those a little bit more. But I think ongoing, like we have in our regular daily schedules, we have like the days that we get on the treadmill and run, and we have the days that we do weight resistance. And I think after reading this, I think I'm going to need a couple of days where I have a 1-hour block, just call it my mental exercise hour a couple of times a week to work on the things and really kind of craft them, because it's an ongoing process.
Yes, definitely. I appreciated a quote from Michael Ovitz, who said that this is one of the best books as a handbook for living your best life. And I appreciated that comment. Right. And really, that's exactly how it's designed to be.
Right. And you have that throughout the book with your, taking the let's call it, for lack of a better, the assessment or the examination and seeing how you score before and after. It's kind of it's an exercise. It's a workbook, not just a textbook for mental health.
Right. And it does begin by giving people the opportunity to take a brief questionnaire, and then from that, they derive their personal resilience profile that shows them on my 9 pillars, which are their areas of strength, and then which are the areas that they need further development. And people who are not wanting to read through the whole book can go directly to those chapters that they need to develop further and read those chapters.
So let me ask you before we start diving into it, what was the motivation for you to write this book?
You know, when I began my work in clinical psychology after I moved out of brain research, I realized how impactful the stresses in our lives were. I realized that a person can be doing well, but as the stresses pile up, our coping abilities actually fall by the wayside. They strain our ability to cope. And I realized that whether we're talking about individuals, whether we're talking about relationships, or even organizations, that stress is a key factor in wellness, a key factor in how successful we are, and ultimately a key factor in our longevity, in our lifespan, and our health span. And so I wanted to focus on how people can best deal with stress because it has such an important impact in our lives.
Right. So you make a great point there about the accumulation of stress throughout our lives. And I think almost everyone that's into biohacking and really wanting to take care of themselves are really they're very understanding of the importance of stress management. But I think it may be one of the hardest elements of the biohacking regimen to get a handle on, because we are not trained to deal with stress very well.
Exactly. And I'm smiling because, last year I did a summit. I hosted a summit on longevity.
Mm-hmm.
And I had a lot of medical experts on, and they talked about everything except stress and stress management, even though it's such an important issue. And I realized the reason that they didn't touch on that subject is because they themselves were having difficulty with the stresses in their lives and were not masters of that subject for themselves. So it was difficult for them to bring attention to something that, in fact, they, just like all of us, tend to avoid. And what's the reason for that? And there are a number of reasons. The first is that our stress response is a survival mechanism that's evolved over generations and generations, over hundreds and thousands of years. And so it's built into the system. But the problem is that we still have an outdated stress response, survival response. We still have the fight or flight mechanism of our hunter-gatherer ancestors. And so, think about all the stresses in your life and your audience's life, and I guarantee very few of them can be appropriately addressed by either fighting the stress or running from the stress. So we build up, our bodies mobilize for fight or flight, and then we're sitting with somebody who we might be in conflict with, or we're sitting down to write a bill or to look at our finances, all of which is stressful, and we're mobilizing our bodies to deal with these stresses with a response that's either to fight or run away. And so then we have to actually hold in all of the energy that we build up, creating even more tension in our bodies. So there's this evolutionary mismatch that already sets us off in the wrong direction.
Mm-hmm.
The second problem is that we have a developmental mismatch. So we learn how to use the stress response in our childhood environment. And for a child, our childhood environment is like the world to us. So we adapt to that world. And then as adults, we go out into the big world, but we're armed with a stress response that's not the best mechanism, because we learn to adapt to our primary caregivers who may not have had the best approach to life themselves. But that's what we adapted to, but we don't know any better. And so that's the second mismatch that sets us off. So if you grew up in a dangerous environment, if you grew up in an environment where there was a lot of judgment, then you go out into the world and you're bracing yourself because you're expecting the judgments, you're expecting the dangers, whether they exist or not, because that's what we adapted to. So all of these reasons, plus think about all the stresses in your day that activate the stress response. But how many triggers do we have in our day that activate the recovery branch of our response?
Right.
Very few. So
Right.
all of these things set us up for what I refer to as autonomic dysregulation syndrome, the dysregulating of our nervous system and literally of all physiological and organic processes that take place in our bodies.
So I think you make a real great point in your book about stress. And I think stress, you have to think of it as it's a normal, essential ingredient of life. Otherwise, we wouldn't have been able to run away from the tiger back in the ancestral days. But like all drugs, it has to be administered in the right dosage. And you talk about, I forget who it was, but talk about eustress, meaning the stress is more of a, I don't know if it's a good way to put it, but more of a healthier type of stress. And that if you're able to do the things in your book to take maybe something that is super stressful and create it into more of a positive stressful situation, that helps you get things done.
Yes, definitely. And that was Hans Selye,
Okay.
who actually was the researcher who took the word stress from physics and brought it into human behavior. And he coined the term eustress for positive stress. And the way I like to say it, and it's very important that we reframe the notion of stress. And I like to reframe it to say that our stress response is actually a tool that we have that helps us be successful in life.
Right.
After all, if we think about all the stresses in our lives, most of them have been associated with stress. A promotion, getting up in front of people to give a presentation, sitting down for an exam. All of the situations that lead to success are associated with stress. So as one of my early mentors, Donald Hebb, said, neurons that fire together, wire together. So we're wired really to seek out stress in our lives. But the key is that there's a stress sweet spot.
Mm-hmm.
A certain amount of stress is good. It helps mobilize, helps us focus, helps us with goal-directed behavior. But there's a sweet spot. And when you pass that sweet spot, you go into negative territory, both in terms of performance and in terms of our health. And so most of us overshoot that sweet spot. And my book is designed to help people figure out how to be within that sweet spot of stress that yields the best performance and the best health.
Well, I would also proffer to say that you're taking that stress performance curve, and with the techniques that you lay out in the book, you're shifting it a little bit so that there's so there is a sweet spot, so to speak.
Well, you're bringing up a very good point from my book, which is that there is this window of optimal levels of stress.
Mm-hmm.
The more resilient we are, the more we stretch, broaden that optimal range of stress. In other words, people who are more resilient, based on my 9 pillars of resilience, are able to go into higher levels of stress and still be at that optimal peak level. So it's another reason why it's so important to be resilient, because you actually perform better at higher levels of stress. This is what athletes are trained to do.
Right. Right. Yeah. And I think you make that point very well. The way you handle something has to do with how much it really affects you physiologically. That, and you talk about these things such as flexibility and other points. Before we get into that, let's talk about primitive gestalt a little bit, because
Okay.
I think that's an important concept. And then I'm going to follow up that question with a question on, what if you just can't remember your stuff from childhood? So, but don't answer that part until you explain the gestalt.
Yeah, yeah. So I've suggested already that we learn how to use the stress response. In fact, we learn the lessons of life in our small little family in our childhood lessons. And we don't decide, we don't figure these things out ourselves. We are sort of like the lessons of our environment and our parents are downloaded into us, and we swallow them.
Right.
And then those become the way we engage with the world. And how does that happen? All of those lessons get distilled into the internal voice that we carry around 24/7. So that internal voice we hear is the repository, in a sense, of all those lessons. So if your parents are continually judging you and telling you should have done that better, or why can't you be like Johnny down the street, all of those lessons go into that internal voice that we carry with us. And so we grow up and we give ourselves those same messages because we've internalized all of them. And I refer to that as our primitive gestalt patterns, because we get closure by coming to conclusions about ourselves and the world. And we have a drive to want to get to conclusions. So we don't wait until we're an adult to figure things out. We come to conclusions based on the lessons of our childhood. And that's why those lessons are so powerful, because we carry them around with us as adults every moment of every day in that voice we hear 24/7.
So after, reading the book and trying to think about what it was that I read, it's like, all right, I know that I have this gestalt pattern that we call primitive, because that's what was imprinted when I was a little tiny kid and all this other stuff. But honestly, I was really trying to go back and say, in my personal situation, was there something that was really bad? And I couldn't come up with anything. It was like, maybe it's buried too far down that it wasn't able to be fetched out, or at least by me. Now, there is a couple of things you talk about in the book to help you kind of maybe identify some of these. So help me out there. How would I attack this so I can see if mom was really that mean to me, or where it is that I was coming from?
Right, right. And, it's interesting because a lot of people have resistance to this process because, number one, they've idolized their parents, or number two, they have a loyalty to their parents, so they don't want to badmouth them. Number three, people feel like, well, it's not possible to love and be angry at a parent at the same time. And so if I love them, how can I be angry with them? And the truth is, the more you love a person, the more potential there is to be angry with them, because they're not responding to you the way you need or want them to respond to you. So, one person said that the therapy process is really uncovering the truth. And I refer to what we're talking about here as uncovering the truth. And we have to approach it from a place of being open to uncovering. It's almost like a mystery, right?
Right.
And so in my book, I refer to it as stalking your pattern. Okay.
Right.
So one of the things I say is that if you're feeling bad in your day, in a situation, I will guarantee that the reason you're feeling bad is because unconsciously you're getting a message from that internal voice that's causing you to feel bad. So, for example, you walk into a room where there are other people and you're anxious. I will so the next step in the process from this notion of stalking your pattern is, okay, what might my internal voice be saying to me that may be resulting in me feeling anxious? And we start exploring, and we might notice that that voice is saying that those people are going to be judging you. Or that message might be saying, you better be careful because you may say the wrong thing, or you may say something that indicates you're not as smart as you make yourself out to be. So these messages, each of those messages that I said might cause me to be anxious. And so now I'm making the connection. Now I'm making the connection between what I'm feeling and how I'm giving myself messages that trigger those feelings. So this is a process that I talk about in my first pillar of resilience, which is our relationship with ourselves.
Right.
And so our relationship with ourselves is how we talk to ourselves, how we treat ourselves. And so there are various messages that we give ourselves that are really harmful to us. For example, some of us feel we should be perfect. We shouldn't make any mistakes. And so that voice may be cautioning us, oh, be careful, you might make a mistake. We may get into a pattern of procrastination because we're afraid to do something that might lead to us making a mistake. And that holds us back from making progress in our lives because we've set these goals for ourselves that are really too high. So that's part of the process. And the second half of that process, if I'm speaking from this internal voice that may be too critical, too negative, too judgmental, how do I deal with that? The way you deal with it is to identify the qualities of a healthy internal voice, or as I like to say, a healthy internal parent. So a healthy internal parent would come from a place of love, compassion, acceptance, support, care, and joy. Okay. So I've identified those as the qualities of a healthy internal voice or a healthy internal parent. So now we have a model. This is the way to treat yourself for your best life. And here's how you are treating yourself.
Right.
So throughout your day, you could be stalking your pattern to notice what messages you're giving yourself. And then you can shift into this voice of the healthy internal parent and contrast the healthy approach versus the way you're approaching a situation. And through that process, the goal would be to gradually come more and more from this healthy voice rather than this negative, critical, or undermining voice.
Yeah, and I thought you pointed out in the book under that first pillar pretty well that we often talk about to ourselves in a much more negative fashion than we would talk to our child or somebody that we're out. And so that if you can then shift that paradigm a little bit where you talk to yourself as if you were the loving parent, I think it makes a lot of sense, but that's not always so easy to do. And it's certainly not the default mechanism that a lot of us will go to.
You've really read my book.
Yeah.
But yes, you bring up a very important tool because a lot of us have difficulty really talking appropriately to ourselves, but yet we do a very good job with our children who we love unconditionally.
Right.
And so I invite people to notice how they might talk to somebody in their lives who they really love and want to be successful. And then can contrast that to how we talk to ourselves. And then I ask the question, is there any reason to treat yourself any less well than you do this other person you love?
Right. Almost like the golden rule unto yourself.
Exactly.
Talk
Yeah.
to yourself as how you would want your parent to talk to you.
Right, exactly.
Right. So let's jump around just a little bit. One of the other things that I thought was very interesting was you showing the association between, let's call it unmanaged stress or stress in too high of a dose, and the lack of hippocampal neurogenesis. Because I thought, we have such a problem with neurocognitive diseases today. I mean, if you look at the percentage of the population, it's a disaster.
Right.
And I think there's a lot of things that go into that, the metabolic issues that we have now that we didn't have maybe 100 years ago. But I think a lot of it, maybe some of it's technology induced. And I was going to ask you, has it become more difficult for you in 2023 and 2024 to work with a client than it was in, let's say, 20 or 30 years ago before all the social media and all of the big tech came about?
Well, life has certainly gotten much more complex, more complicated. And I think people feel a much greater level of insecurity, and there's more unknowns in the world. And all of those are triggers for the stress response. And so we have, to answer your question, we have more triggers for the stress response. And then we may turn to these devices here, and they don't make us any less stressful. In fact, they contribute to greater stress.
Right.
And so we're living in a time in which we need to pay more attention to how we deal with stress. But let me step back to what you were alluding to earlier on. And, in the past, it was a derogatory term to say when a physician, let's say, they did all of their testing and they didn't find anything, and they would say, it's all in your head.
Mm-hmm.
And that became a pretty derogatory term, like
Right.
I'm crazy. And
Right.
we labeled it as crazy. But stress is the transducer. Stress is what translates emotional upsets into physiological consequences.
Okay.
And we now have literally thousands and thousands of studies that show the impact of stress on our bodies, on our physiology. And the way that works, as I alluded to earlier, is the dysregulation of the nervous system.
Mm-hmm.
So we have all of these stimuli in our day, in our lives, that activate the nervous system,
Right.
the sympathetic branch of the nervous system. But we don't have anything in our day, in our lives, that trigger safety, trigger recovery, trigger relaxation.
Right.
And so there's this dysregulation between the activation of our stress response without the appropriate recovery necessary by the parasympathetic recovery branch of our nervous system.
Right.
And so it causes all kinds of wear and tear on our body and on our brains. And we have clear evidence that stress impairs the functioning of key areas of our brain, the prefrontal cortex and the hippocampus, to name just two.
Mm-hmm.
The hippocampus serves many important functions, but interestingly enough, one of the functions of the hippocampus is to put a brake on the stress response. So when the stress response occurs and we start to activate, the hippocampus steps in and literally puts like a brake on the stress response. Ironically, the more stress we experience, we get an impairment of the hippocampus, and so it's less capable of putting the brake on the stress response, and so it's a vicious cycle there.
Right.
The hippocampus is also a primary source of neurodevelopment, of neurogenesis, literally the birthing of new nerve cells. And that's impaired by the stress response as well. So there are many ways that the brain is impaired, but in a more acute sense, when we are under stress, when we think there's a danger, the brain literally shifts blood flow from the frontal cortex back to the more primitive centers of the brain because we go into fight or flight.
Right.
When that happens, many people notice they get cognitive fog. Many people notice they're not able to think as clearly. And that there's a good reason for it because blood is being shifted away from the more advanced, evolutionarily advanced parts of our brain that are engaged in problem solving, in creativity. And so we lose some of that during stress acutely, but also chronically.
Before we continue with this great discussion, I just want to take a quick break to acknowledge this week's sponsor. I'm constantly exploring new avenues to enhance well-being and address any health concerns. Today, I'm thrilled to introduce you to an exciting supplement called STEM Regen, which I take daily and genuinely believe could revolutionize your health journey as well. STEM Regen stands out as a game changer in the realm of wellness. Crafted from 5 potent plant extracts, it boasts a remarkable ability to stimulate the release of your body's own stem cells from your red bone marrow. Why is this significant? Well, stem cells are the superheroes of our body's natural repair system. They possess the extraordinary capacity to morph into various cell types, aiding in tissue regeneration and repair. As we age, the quantity of circulating stem cells in our system reduces significantly, impairing our body's ability to heal and rejuvenate itself effectively. STEM Regen steps in to counter this decline by kickstarting the release of stem cells into circulation, thereby bolstering your body's innate repair mechanisms. Once released into your bloodstream, these mobilized stem cells actively seek out areas of damage or injury, initiating the healing process. By incorporating STEM Regen into your daily routine, you're essentially empowering your body to tap into its own regenerative prowess more efficiently. I firmly believe that STEM Regen could be a valuable addition to your wellness regimen, especially if you're seeking to fortify overall health and vitality, accelerate tissue repair, or expedite recovery from injury or illness. This first-of-its-kind stem cell mobilizer is changing the game in regenerative medicine. Don't wait to unleash your body's innate healing capabilities. Visit stemregen.co and use the code SBPOD to get a 15% discount off your first order of STEM Regen.
So, to go on further a little bit about the neurogenesis, because you do talk about this as well, and that is that if we're unable to, let's call it, unwire the stuff that's happening from our primitive gestalt, and if we just keep going down that path, that's going to basically, if there is going to be any neurogenesis, those are going to be neurogenic phenomena that are going to be reinforcing that which is already there, even that much more. Am I getting that correct?
You're getting it correct, but what I like to say that there's good news here as well.
Okay.
And the good news is in the literally the resilience of our brains. You know, I published a study a couple of years ago. One of the things that I've helped to pioneer is a training called neurofeedback.
Mm-hmm.
Neurofeedback is a type of biofeedback in which you monitor some aspect of your physiology. You feed that information back to an individual, and with that feedback, we can learn to gain control over our own physiology.
Right.
So neurofeedback is a specific type in which we monitor the brainwave patterns of a subject. We feed that information back so that a person can literally learn to shift their brain waves into more optimal or more healing patterns. And 2 years ago, working with a couple of colleagues here at UCLA, we did a neurofeedback intervention with breast cancer survivors who were experiencing chemo brain. A chemo brain is an impact of both the cancer and the chemotherapy, in which the brain literally becomes impaired. And we looked at those brains and we saw significant physiological impairment, in which their low frequency brainwave activity, which normally occurs during sleep,
Right.
was more than 2 standard deviations elevated. So of course, they were going to have cognitive fog, cognitive impairment.
Right.
You know, some of them said, I can't read a novel because I can't keep the link of the story. And we did a neurofeedback intervention and we saw a significant, almost complete normalization of brain function. And that demonstrated to us that even in those severe cases, the brain has tremendous capability of recovering, of literally restoring functions. And that's what we call neuroplasticity. And so on the one hand, we have this power of these primitive Gestalt patterns. But on the other hand, we have this tremendous ability for neuroplasticity and resilience of the brain. And all it takes is following a program of resilience to literally become healthier.
So what were some of the interventions that you used for that particular neurofeedback study?
So in that study, and the only training was the neurofeedback training. So we had electrodes on 2 locations in the brain, referred to as C3 and C4, central locations. And we, on the screen, the computer pulled out the frequency bands that were elevated.
All right.
And so every time that the person, their brains lowered those frequencies, they would get rewarded. The bar graphs would turn from red to green and a tone would go on. At the same time, the frequencies that we wanted to bring up, to elevate, those bar graphs would turn green when they went up. And so you have these bars that the subject is watching that can be green or red based on whether they were success or not. When they all turned green, the tone went on. And so we had 30-minute trainings and we did 18 of those. And we saw all of these tremendous improvements in behavior, in cognitive functioning, in ability to sleep, and other things. And so it was based on giving them feedback about their brainwaves so that they literally learned to shift their brainwaves into more optimal states.
But so I just need a little bit more clarification on that because I'm having a hard time understanding. I'm hooked up. I'm watching the screen. I'm wanting to try to either increase my lower frequencies or vice versa. Did you give them some little technique to say, okay, well, this is how you might be able to shift that? Because in the book, you talk about when you walk through a doorway, the portal, you just take a second and say, yeah, I'm here and I'm actually going to experience the present.
Yeah. So this is fascinating. This is amazing. This is the power of our brains. All we needed to do was give the brain feedback about what was going on in its inside, and it self-adjusted. The brain self-adjusted. All it needed was the feedback showing it when it was successful, and it learned to go more and more into those successful patterns.
Interesting.
Amazing.
No breathing techniques or any little.
In this case,
no,
nothing. In this case, it was just pay attention.
Yep.
And the goal is to make the bars go green and for the sound to go on.
Interesting.
And the brain, it's an operant conditioning paradigm where the brain used the feedback and the brain was paying attention to when it got the positive feedback and did that more and more. And that's the basis of biofeedback, is
Right.
that you get some rewards, and then it encourages you to do whatever triggered that reward more and more.
Nah, that's very interesting. There's so much about the brain that is still in the, ultimate final frontier. It's pretty crazy about
Yeah.
it. So, you also talk about the fact that a lot of very, very successful people are very stressed individuals because the stress helps them get things done. It's kind of like their reward mechanism, so to speak, and they become more successful, and then they become more stressed, which is a little bit counterintuitive. A lot of times you would think, well, if I've got this really super successful person, they probably don't have to worry about as much that the person who maybe doesn't have as much success would have to, I got to pay my bills this week, that type of thing. So I thought that was kind of an interesting association.
Yeah, our expectations keep rising with our successes.
Mm-hmm.
And we keep setting the bar higher and higher. And as I said before, in a sense, we become addicted to stress because it's been associated with success.
Mm-hmm.
But we also become addicted to stress for other reasons. Let's go back to the notion of biofeedback, and there's a different type of biofeedback in which you monitor skin conductance.
Mm-hmm.
Okay, so skin conductance is about when we're anxious or tense, people may notice that their hands become clammy or moist. Okay,
Right.
If you put two electrodes on two adjacent fingers and you monitor the circuit, as you're more stressed and there's more moisture being produced, a tone will go up. As you relax and your pores close and get drier, the tone comes down. And so we use this as a biofeedback device to train relaxation. The goal is to bring the tone down. And as you focus on an optimal breathing pattern and letting go of tension in your body, the tone will go down. Now, an interesting thing happens when I do this with a lot of people. The tone will keep going down. And then all of a sudden, the tone will start going up again. Okay, so the tone went up. Let's bring it back down. And we'll bring it back down. And just at about the exact same place, it'll pop up again. What's going on here? When I discuss this with a lot of the people that I work with, what they will typically say is they began to feel uncomfortable.
Mm.
They're getting more relaxed, but they're
Right.
starting to feel uncomfortable. What's that about? Typically, it's that feelings that we've pushed down, painful feelings we don't want to address. And we learned this defensive mechanism as a child, again, primitive Gestalt pattern. And so as we relax more deeply and we let down our guard, these feelings start to come to the surface. We feel uncomfortable and we jerk awake, so to speak, and bring that activation up. And so the point I'm getting at here is a lot of us maintain stress because it distracts us from these deeper feelings that we've learned to push down.
Wow, that's very interesting. If you just think about what you just said. So maybe this is why I have such a hard time relaxing, because, people will say, what are you going to do for vacation? And I said, I don't know, probably go someplace and work. It's very hard. I wished I could be just one of those guys that could go to the beach and hang out and just love the smell of the salt water and the atmosphere. But so I guess I have to figure out how to strip my primitive Gestalt away so that I can let these things come up to clean them up, so to speak, in order to be able to relax.
And so that's in my book. Again, my book, I've designed my book not just to give information. I want to get results. I want people to follow through. And so I needed to deal with people's resistance And this is one source of resistance. People are reluctant to do anything that may bring up their feelings. And so that's why the notion of the path takes us step by step through a program, so that when we get to my sixth pillar, which is emotional balance and mastery, people are already feeling successful in the process and are willing to take a look, because now they realize that they need to deal with their feelings if they want to fully be in control of their lives. Because to a great extent, we are driven by unmet emotional needs that drive us in certain directions, but because it's unconscious, we never achieve what we're trying to achieve, which is, for many people, is just a feeling of peace in our life, in the world.
Right.
But getting back to what you were talking about, where, I'm going to take a vacation, I'm going to go someplace and work. This is not uncommon, because to a great extent, our value is embedded in what we produce. Our value is embedded in our accomplishments, our achievements.
Right.
And so it's hard to sit down and just relax without thinking I should be doing something.
Right.
And so we need to learn that actually, for our best performance and our best health, again, we go back to the balance of those two branches of our nervous system.
Well, I think you can make a similar analogy to physical exercise as well. I mean, you have to have recovery days in order to maximize the benefit of what you've done in that day's workout the day before, or whatever. And there are a lot of people that actually exercise to their detriment. And
that's a very good point. And it's a very good analogy. Thank you for bringing it up.
So let's jump around just a little bit. I mean, there's so many questions that I wanted to ask you. I'll jump to this one, and it may not be a very good question, but I preface the question in, as I've gotten older, I feel like I've gotten much more malleable, more flexible. I don't get as angry as I did when I was a young man, that type of thing. What's harder to treat now from a psychotherapy standpoint, the older person or the younger person? I know it's contextual. I know there's a lot of contextual variables there, but I'm just, throwing that out there.
Right. Well, it brings up a couple of things for me. One, when I started out in my career, the general belief is that you're born with a full complement of neurons.
Mm-hmm.
And then it's downhill from day one. You just lose them,
right,
and you don't get any new ones.
Right.
In the last 20, 30 years, we've discovered that, in fact, the opposite is true. That we birth new nerve cells, referred to as neurogenesis, throughout our lifespan into old age.
Mm-hmm.
So that's great news, because we complement that with this notion of neuroplasticity, that we're able to literally redesign our brains based on intention and new learning. And so I like to say that one of the keys to resilience is having a growth mindset. This is my fifth pillar. A growth mindset means that when you identify a shortcoming in yourself, you don't go, okay, I guess I'm not able to do that. Instead,
Right.
You go, okay, what do I need to learn so that I get better at this, and so that it's no longer a shortcoming? That's a growth mindset. And so, to answer your question, it's more about having this growth mindset versus an older or younger person is more or less capable. There are reasons why a younger person can be more capable of learning new ways, and there are reasons why an older person can do a better job of learning new ways. One of the reasons why I would say an older person might do better is because the older person has already encountered the impact of stress. They're already sitting with 1, 2, or 3 physical symptoms that are the result of of poorly managed stress. And so they're more motivated because they're suffering physically, chronic pain or some other physical symptom that I could directly associate with too much stress in their lives. So that added motivation may encourage them to follow through with the steps needed to become more resilient.
Yeah, that's kind of where I was looking at it from too. You know, I mean, there's different baggage that we hold as older folks versus younger folks, and then I think, you know, there's some of the younger generations that have been, their primitive gestalt is probably vastly different than what ours is, because, you know, we did totally different things in our childhood than my kids did when they were, you know, children. And so I was just kind of interested to get your thoughts on that. And of course, it's highly variable, and you're not trying to paint the picture that this is the way for everybody, of course. But I was just thinking about that from my own personal standpoint. It's like, if I was going to go into therapy 30 years ago, I think I would have been much more difficult to treat than if I went into therapy right now, because I don't know, as you get older, you get wisdom, and I think you see things with a lot more latitude than you might when you're real young.
Yeah, I think that's definitely the case, but I could also make it the opposite case. I remember when my children were in their teens, I was amazed at the awarenesses they had that I didn't have until I was in my 30s.
Right.
Because of what they were learning in school, and learning about life and learning about stuff that I didn't know growing up. So I saw some advantages that they had, awarenesses that they had, that probably facilitated their own growth and development. So I think we can make both arguments in both directions.
Yeah, and I think by having those arguments in both directions, you can sometimes kind of pick up things that could be helpful on both sides, so to speak.
Right.
But so the 9 pillars, the last pillar is the power, right? The
Right.
ability to, I guess, synthesize all this together. So just to kind of wrap up a little bit, there's a lot of information in this book, so I encourage everybody who's listening to the show to go out and get a copy of this, and not only just buy it to read it, but buy it to implement it in your normal structure, your routine, because you point out eloquently that in order for this stuff to work, it's got to become part of your habit.
Right.
So,
And that's why I've created the notion of the path in the book, because people can feel overwhelmed by all they feel they need to do to become more resilient. And we can't do everything all at once. And so what happens with a lot of people is they'll start doing some things, and very quickly they'll look at the things they're not getting done, the things they're not doing, and they'll get discouraged. And so I like to say that the path is alongside you every moment of every day. And that if you go to my book and you just take a few steps that I suggest in my book, those few steps will put you on the path. And once you're on the path, you've achieved success for today. And so success is available and accessible to you every day. And once you're on the path, you're now going in the right direction, and you can be reassured that you're growing your ability to be resilient. And so even if you fall off the path, you could take a few of these steps that put you right back onto the path.
I think one of the things you pointed out in your first pillar, basically learning how to deal with yourself better, call it self-respect, self-love, whatever we want to call it, is just to look at it like we talked about a little bit earlier. How would your parent talk to you about this? I mean, we all have done things. There's not a human that walks this planet that hasn't done something that they're either ashamed or embarrassed or feel very bad about. But that can't be changed. It's long in the past, but what you're able to do as far as just the continued rumination over this just if you just kind of forgive yourself and say, listen, you got to let that go because it's not doing you any good, and you identify that, I think that might be one little step to get you on the path.
Yeah, and in my book, I actually take people through a process of letting go of mistakes that they've been beating themselves up about for a while. And I also take people through the steps of who feel anxious of how to work through steps to let go of anxiety. And, in each of my pillars, I have these processes that address what I found are the most common mistakes and issues that people have. But you also mentioned the ninth pillar, which is power, which I define as the ability to get things done.
Mm-hmm.
And in my book, I have a pyramid that has all the 9 pillars, and the ninth one, power, sits on top of all the rest. And in business, that's the pillar that people focus in on, getting things done, being productive. But I show in my book and in that model that ninth pillar sits on top of all the others.
Right.
And to be most effective and most successful with the ninth, you develop all the other 8.
The ninth is almost like a byproduct. If you get all the first 8 done, the ninth probably is going to happen.
It's going to follow a lot more easily. You're going to be more able to engage in being persistent, in exploring, in being courageous, all the things that develop through the other 8 pillars. Correct.
So there's one other thing that I wanted to just mention because I thought it was great. And you talk about presence, that you being in the present actually opens you up to this, let's call it the advanced neurogenesis or neuroplasticity that we want to change in the positive manner. I think that's something that, I think it's easy to just forget about this because how many times have you driven to the office and you don't remember that you passed the gas station that you always pass? Because we get so wired and so entrenched in our little routines and everything, but just something as simple as, all right, when I walk through a doorway, I'm going to take that moment. That's my trigger to get into the present. There's a lot of power in that. And then that's what I think is kind of cool about these techniques that you've laid out is that you grasp one of them and all of a sudden you start doing that for a little while. You can actually feel it take effect, but you have to have a trigger for you to do it.
Right. And I'm glad you bring up that's my 7th pillar, presence. And each of my pillars has a unique aspect of the overall resilience. And presence is so important because if you want to learn new ways of doing anything, it begins by recognizing you're going in the wrong direction. If you want to change your thinking patterns, you have to begin by noticing, oh, look at I'm thinking negatively. So there's that awareness that comes from being present. So I like to say that in some respects, presence, my 7th pillar, is the gateway to resilience because it gives you the ability to recognize an old and perhaps harmful habit and for you to say, no, I'm not going to do it that way. I'm going to come over here and do it in a more positive way, such as thinking patterns, negative thinking patterns, recognizing I have to be present in the moment to recognize so that now I can think more positively. So presence becomes very important. And we talk about these devices. One of the consequences of all the technology is we've literally lost the ability to be present.
Oh, amen.
Right.
I mean, how many times have I sat down and within 30 seconds, I'm on this damn thing because I want to see what's going on. And it's just one of those things that it just is I think it's an element of our society where the smartphone is really beneficial to a lot of things, but it's like drugs. There's a therapeutic drug window and there's a non-therapeutic. And I think, just setting this thing down and focusing on, the smell of the steak that's cooking on the grill or whatever,
Yeah. And most of us have a resistance to being present and a resistance to practicing some form of present-centered, such as mindfulness training.
Mm-hmm.
And that's because of all the judgments we make. And so I anticipate people's resistance to becoming more present in that seventh pillar and give them certain techniques to develop greater presence.
I think it's a great manual. I hate to call it just a book because that doesn't do it justice. And I just think it's a tool. It's a manual that will help you achieve what you want to achieve. And let's face it, if you don't have a good mentality, the rest of your life really is probably not going to be so good as well.
Right.
So
exactly right.
Thanks so much for coming on. Thank you for writing the book.
It's been my pleasure. And Stephen, you've asked great questions. I appreciate it.
Well, you wrote a book that required me to ask great questions. So thank you very much.
Having neuropathy pain? Get relief at U.S. neuropathy centers. If you're suffering from neuropathy symptoms like numbness, tingling, or burning pain in your feet, you're not alone. Over 20 million Americans are impacted by this condition. At U.S. neuropathy centers, we specialize in using cutting-edge, non-surgical and surgical treatments to reduce neuropathy pain and restore nerve function. Our protocols combine metabolic support, neurovascular therapy, and regenerative medicine, an approach that gets results many times when others fail. Don't let neuropathy keep you from living your best life. Take the first step and call U.S. Neuropathy Centers today. 404-228-9892 or visit our website at nervetx.com.
I hope you all enjoyed today's show and got some truly empowering knowledge out of it. You can always follow up on anything we talked about in the show notes found at our website, podofinquiry.com. If you think you might have tickled just a few neurons inside that cerebral cortex, please spread the word to your friends and colleagues and tell them that they need to get spelunking. Also, if you can take a minute to leave a review on your podcast provider of choice, and especially Apple Podcasts, that would greatly help the show and be so appreciated, provided it's positive. And if not, then just keep your pie hole shut and stay down in that cave. Let's keep spelunking.
This podcast is designed for informational purposes only and does not constitute any medical or surgical consulting advice or imply a development of any physician-patient relationship. The opinions of guests who are featured on the show are not necessarily the opinions of Dr. Barrett or the production team. This podcast is owned solely by Barrett Medical and Surgical Media, LLC. While the show is highly oriented for physicians and healthcare providers, anyone interested in the improvement of human performance and understanding will find this a welcome goblet to sip from, or guzzle. However, no representation or warranties are made in any way whatsoever on this podcast for any products, techniques, or other things discussed. Invited guests are not vetted by the Pod of Inquiry for their qualifications and may have a direct or indirect financial interest in what they present and discuss on the show. The Pod of Inquiry disclaims any responsibility from anything taken from the show and used personally or professionally. It is a responsibility of the listener to perform their own due diligence prior to the implementation of any ideas, products, techniques, or anything talked about on the show.